The nurse reviews the arterial blood gas results of a client and notes the following: pH 7.45, PCO2 of 30 mm of mercury, and HCO3 of 20 milliequivalents per liter. The nurse analyzes these results as indicating which condition. 1. Metabolic acidosis, compensated. 2. Respiratory alkalosis, compensated. 3. Metabolic alkalosis, uncompensated. 4. Respiratory acidosis, uncompensated. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client for manifestations of which disorder that the client is at risk for. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The nurse is caring for a client with several broke ribs. The client is most likely to experience what type of acid-base imbalance? 1. Respiratory acidosis from inadequate ventilation. 2. Respiratory alkalosis from anxiety and hyperventilation. 3. Metabolic acidosis from calcium loss due to broken bone. 4. Metabolic alkalosis from taking analgesics containing base product. A client has a hemoglobin level of 10.8 grams per deciliter. The nurse interprets that this result is most likely caused by which condition noted in the client's history. 1. Dehydration. 2. Heart failure. 3. Iron deficiency anemia. 4. Chronic obstructive pulmonary disease. A client is recovering from abdominal surgery and has a large abdominal wound. The nurse would encourage the client to eat which food item that is naturally high in vitamin C to promote wound healing? 1. Milk. 2. Oranges. 3. Bananas. 4. Chicken. Chemotherapy dosage is frequently based on total body surface area, BSA, so it is important for the nurse to perform which assessment before administering chemotherapy? 1. Measure the client's abdominal girth. 2. Calculate the client's body mass index. 3. Measure the client's current weight and height. 4. Ask the client to share current weight and height. A client with metastatic breast cancer is receiving tamoxifen. The nurse specifically monitors which laboratory value while the client is taking this medication. 1. Glucose level. 2. Calcium level. 3. Potassium level. 4. Prothrombin time. The nurse is caring for a client admitted to the emergency department with diabetic ketoacidosis, DKA. In the acute phase, the nurse plans for which priority intervention? 1. Correct the acidosis. 2. Administer 5% dextrose intravenously. 3. Apply a monitor for an electrocardiogram. 4. Administer short-duration insulin intravenously. A client has just been admitted to the nursing unit following thyroidectomy. Which assessment is the priority for this client? 1. Hoarseness. 2. Hypocalcemia. 3. Audible stridor. 4. Edema at the surgical site. The nurse is assisting a primary health care provider in the examination of a 3-week-old infant with developmental dysplasia of the hip. What test or sign would the nurse expect the primary health care provider to assess? 1. Babinski's sign. 2. The Moro reflex. 3. Ortolani's maneuver. 4. The palmar plantar grasp. The nurse creates a plan of care for a child at risk for tonic-clonic seizures. In the plan of care, the nurse identifies seizure precautions and documents that which items needs to be placed at the child's bedside. 1. Emergency cart. 2. Tracheotomy set. 3. Padded tongue blade. 4. Suctioning equipment and oxygen. A 5-year-old child arrives at the emergency department, and the child's parents state that the child fell off a bunk bed. A head injury is suspected. The nurse checks the child's airway status and assesses the child for early and late signs of increased intracranial pressure, ICP. Which is a late sign of increased ICP? 1. Nausea. 2. Irritability. 3. Headache. 4. Bradycardia. The clinic nurse reads the results of a tuberculin skin test, TST, on a 3-year-old child. The results indicate an area of induration measuring 10 mm. The nurse would interpret these results as which finding? 1. Positive. 2. Negative. 3. Inconclusive. 4. Definitive and requiring a repeat test. 14. The surgeon asks the nurse to obtain a urinary catheter that will be used for continuous bladder irrigation. Which urinary catheter would the nurse obtain? 1. A straight catheter. 2. A coud tip catheter. 3. A triple lumen catheter. 4. A double lumen catheter. A primary health care provider has ordered digital removal of stool for a constipated client. How would the nurse position the client for this procedure? 1. Prone position. 2. Lithotomy position. 3. Left lateral side lying position. 4. Right lateral side lying position. A client with Crohn's disease has just had surgery to create an ileostomy. The nurse assesses the client in the postoperative period for which most frequent complication of this type of surgery. 1. Folate deficiency. 2. Malabsorption of fat. 3. Intestinal obstruction. 4. Fluid and electrolyte imbalance. The nurse is preparing to provide wound care to client with a stage 1 pressure injury. Which dressing would the nurse expect to be prescribed in the treatment of this wound? 1. Hydrogel dressing. 2. Transparent dressing. 3. Antimicrobial dressing. 4. Calcium alginate dressing. A client being measured for crutches asks the nurse why the crutches cannot rest up underneath the arm for extra support. The nurse responds, knowing that which would most likely result from this improper crutch measurement. 1. A fall and further injury. 2. Injury to the brachial plexus nerve. 3. Skin breakdown in the area of the axle. 4. Impaired range of motion while the client ambulate. The nurse has just reassessed the condition of a postoperative client who was admitted 1 hour ago to the surgical unit. The nurse plans to monitor which parameter most carefully during the next hour. 1. Urinary output of 20 milliliters hour. 2. Temperature of 37.6 degrees Celsius. 3. Blood pressure of 170th millimeters Hg. 4. Serous drainage on the surgical dressing. The nurse assesses a client's surgical incision for signs of infection. Which finding by the nurse would be interpreted as a normal finding at the surgical site? 1. Hard reddened skin. 2. Serous drainage. 3. Purulent drainage. 4. Warm, tender skin.